Good morning. I'm Cheryl Zimmerman, co-editor-in-chief of JAMDA, and along with Phil Sloan, we'll be providing a brief update of JAMDA, the Journal of the Society for Post-Acute and Long-Term Care Medicine. We'll look ahead to the upcoming year, and we will bestow the John Morley Award. As the Journal of our society, the mission is to provide practical information and research directly applicable to healthcare professionals providing post-acute and long-term care, as well as to policymakers, organizational leaders, educators, and advocates. And for those of you who've been with JAMDA over the years, you may have noticed that our cover has gotten a facelift recently, which was about time because we are now 20 years old. In describing the scope of JAMDA, we consider the core to be post-acute long-term care itself, including rehab and residential and home-based long-term care. Building out from there, the scope includes people in or at risk for post-acute and long-term care, covering topics such as geriatric syndromes, dementia, palliative care, and social support, and of course issues related to risk and prevention of different syndromes. And embracing all of that is basic mechanistic and clinical research relevant to understanding post-acute long-term care or persons at risk for it. Now I'll touch on just a few updates from the last year. The relevance of the mission of our society and our journal is pretty evident in the 5-year submission trend of papers to JAMDA. What you see is that there's continued to be growth in the submissions, and in the last year we had a 12% increase over 2018 in submissions. And of course, we're a global journal because post-acute and long-term care is relevant across the globe. In the last year, 81% of the papers were submitted from outside the U.S., as were 68% of the papers that were accepted. In an effort to further increase the relevance of JAMDA to our society members and to other readers, we publish 4 theme issues a year. In these theme issues, we compile papers on a given topic to provide a comprehensive perspective on timely research. In 2019, the topics were muscle strength, mass, and function, post-acute care and rehabilitation, interventions in long-term care, and lower extremity function. In 2020, so far, we've focused on infection and post-acute and long-term care, and April, there will be an issue coming out on hospitalization of older adults. And in terms of the papers that most resonated with readers, we've compiled here a slide of the 5 most downloaded papers in 2019, the topics of which are strength and muscle mass, another one on exercise, hospitalization and antipsychotic use, hip fractures, and underlying mechanisms of frailty in relation to brain structures. And lastly, on an especially timely topic, these 3 editorials were recently published or just about to come out in the upcoming week, which address COVID-19. One is on practical guidelines for long-term care populations. Another one is the importance of assisted living within the context of COVID-19. And then another very intriguing paper by one of the senior associate editors, Dr. Cesari, on ageism related to decision-making for COVID-19. So I'll now turn this over to Phil Sloan, who will look ahead in 2020 for the future of JAMDA.
Thank you, Cheryl, and hello, everyone. Thanks for tuning in virtually. In the interest of time, I will only highlight 2 action items for the coming year. The first is an appeal to experienced clinicians in the audience. JAMDA gets very few clinical reviews on common medical issues in post-acute and long-term care, yet they are important to us and our readership. Furthermore, we know from the annual and chapter conference presentations and from knowing many of you personally that JAMDA is full of experienced clinicians. Many of you have a topic you're passionate about, have researched, and could write about in an authoritative way. JAMDA needs you to put pen to paper. We have 3 submission categories that are suitable for this kind of expert review: problem-based narrative reviews, special articles, and controversies in care. JAMDA's online author information can provide details. We know everyone's busy these days, so please consider sharing your knowledge and passion in this way. If you're interested, email us at JAMDA and we'll provide some guidance. My second issue is about an upcoming call for papers for a theme issue on medication use. focusing on challenges and controversies in long-term care. So please spread the word. The deadline will be August 31st for submissions, with the theme issues slated for January 2021. And lastly, as a drum roll, I would like to present this year's John Morley Award winner. The Morley Award was initiated in 2018 to recognize the research article published during the previous year that was considered most likely to have impact on practice and policy in post-acute and long-term care. This year's winner is an original research article entitled Ultra Brief Screeners for Detecting Delirium Superimposed on Dementia. Our recipient and the paper's first author is Erika Steensma, a fourth-year medical student at the University of Michigan. She completed her research at Harvard through the Medical Student Training in Aging Research Program, MSTAR for short, a wonderful summer training program jointly sponsored by the National Institute on Aging and the American Federation for Aging Research, which supports approximately 100 students a year at 7 sites. Erika's paper involved working with a distinguished research team. Its topic, delirium superimposed on dementia, is a challenge we are all familiar with. So let us now recognize and hear from the 2020 Morley Award recipient awardee, Erika Steensma.
Thank you so much. It is such an honor to be here receiving this award on the behalf of my research team. I know that this session looks very different than I'm sure a lot of people imagined while planning this conference, but I'm so grateful for all of those who worked so hard to make this virtual conference possible and successful. I'd like to take a few moments to discuss the research that we did for our paper. Delirium, as we all know, is a common and morbid condition and is associated with increased rates of both cognitive and functional decline. Pre-existing dementia is a major risk factor for delirium, yet makes the diagnosis far more challenging. Therefore, our team aimed to develop a highly sensitive, specific, and efficient screening tool for delirium superimposed on dementia. To do this, we analyzed data from a prior research study conducted by one of our primary investigators, Dr. Fick, which included almost 400 patients, all with dementia, who were tested daily for delirium. We performed statistical analysis of the individual cognitive testing items from this reference standard delirium assessment to determine their effectiveness in screening for delirium. We found that a 3-item screening tool consisting of a test of orientation, attention, and arousal state was our most effective way of screening for delirium superimposed on dementia. More specifically, the combination of questions, what place is this, having the patient recite the days of the week backwards, and determining whether or not this patient was sleepier than usual was the best 3-item screening tool. This test had a sensitivity of 94% and a specificity of 42%. With this high sensitivity and moderate specificity, this tool could effectively capture over 90% of cases in delirium, as well as rule out more than 40% of negative cases of delirium. This would effectively allow providers to rapidly screen and focus their attention on patients requiring more in-depth attention for delirium diagnosis and treatment. Although this test needs to be validated in a patient population, this preliminary tool is very promising as it could give providers a means to rapidly target delirium management in populations with high prevalences of dementia, ultimately leading to better outcomes for this highly vulnerable population. In conclusion, I'd like to take a moment to express my gratitude for the support of my research mentors and all of their assistants that helped make our research so productive and successful. When I came to work with Dr. Marcantonio and Dr. Fick through the UnStart program, I had no prior experience with clinical research, and I didn't even really know what it would look like. But their support and encouragement, as well as the support of all of the staff working with them, kindled a love of clinical research in me, which I hope to take into my career. I think now, more than ever, with the pandemic that's really affecting almost every one of us, the value of research and scientific inquiry can really be seen. I'm so excited to be joining the rank of physicians and scientists everywhere and continuing to further healthcare and improve outcomes for patients and families. I am so thrilled to be doing it in such a supportive and collaborative environment as the one that I experienced through this project. Thank you so much.